They're talking about nasal naloxone. Nasal naloxone is an antagonist that only works on heroin and other prescribed opioids and fentanyl. It's used to reverse an opioid overdose. The way it works is when somebody has an opioid in their system, the opioid molecules bind to the receptors in the brain, a lot of them that control breathing. If they take too much heroin or too much of an opioid, too much of it binds and will slow the breathing down until the person has an overdose. What Narcan does is when it's introduced into the body, it's an antagonist and it knocks that opioid off of the receptors and it binds itself to the receptors to prevent the opioid causing the overdose. The effects of Narcan last from 30 to 90 minutes. So it's important that if somebody has an overdose, they have to call 911 right away to get help in there to make sure that the person is assessed and they don't relapse. Because there is a good chance if they had an overdose because of the amount of opioids they had in the system to begin with, after 30 to 90 minutes, they can have an overdose again. And the Narcan won't repeat it unless it's reintroduced into the body. Narcan can cause withdrawal symptoms, so that if you use this and a person recovers from it, from the overdose, they're going to have withdrawal symptoms and they're going to be angry generally because you ruined their high, so you got to make sure that help is there. It's perfectly safe and can be used many times. It won't affect anybody. Some of the risk factors for an overdose is tolerance. A lot of times what will happen is somebody will have been using for a while and they may go into recovery or stop using for a period of time and their tolerance goes down. Once you have that first high, it's difficult to achieve that high again. So people use more and more and more of the drug to try to get that high. Their body craves it, their brain craves it. It's out of their control. They have to keep their brain happy, so they use more and more and more. So oftentimes when they go to recovery, they're not using for a while, and when they come out, they use the same dose they were using before they went in, and that can cause an overdose. Mixing drugs often can cause an overdose when you have opioids and benzoids or some other kind of drugs that can cause an overdose. If you mix uppers and downers, that can cause an overdose. Physical weight and physical fitness of the person can cause an overdose. A lot of times a person that is smaller may use the same dose that a person who is larger, and that smaller person can cause an overdose because of their physical size, or their physical health can also cause an overdose. The methods of use or changing of use can cause it. For instance, if somebody is using prescription pills, prescription opioids, and they change to injection or snorting, that can cause an overdose because their system is not used to it. The unpredictability of the drug. A lot of times people think they're buying opioid pills when in fact they're laced with fentanyl, or they're buying heroin that's laced with fentanyl. They're finding now that there's even fentanyl laced in marijuana. Fentanyl is the most powerful opioid out there, and it takes far less fentanyl to cause an overdose than heroin or other opioids. Having recovered from a previous overdose increases your risk for an overdose, as well as using the drug alone. If you're a family member, you want to plan for an overdose. You want to make sure you have Narcan readily available to use in case your friend, family member, or loved one overdoses. A couple of tips with using the Narcan is you want to store it in a cool place. It shouldn't be stored over 77 degrees. It does have a shelf life, so you want to check the shelf life occasionally. And we don't recommend storing it in a bathroom, because a lot of times our loved ones or family members or friends will use it in the bathroom. If they overdose in the bathroom, they run the risk of losing consciousness and blocking the door, especially if it's a small bathroom. So keep it in a handy place, whether it's a bedroom drawer or a kitchen area where it's nice and cool but easily accessible. What are the symptoms of an overdose? Well, the most obvious symptom is somebody isn't breathing. The other symptoms is they're not tolerating pain. So if somebody's unconscious and you can't wake them, you try to wake them, you call their name, you shout them and shake them, they don't respond, that's a symptom of an overdose. You want to see if they respond to pain. So the best thing to do is take and make a fist. Use your knuckles and rub it on the sternum, that's the bone, the breastbone between your rib cage. Rub it hard. And if they don't respond, chances are they're overdosing. Look for their lips. Are they blue? Their fingertips blue? If they're not wearing nail polish. Are they cold and clammy and pale? That's another sign. Are they breathing very shallow and only a few times a minute? That's another sign of an overdose. They may be awake but not able to respond. Those are all signs of an overdose. If you're alone and you suspect an overdose, the first thing you want to do is call 911 right away. It's a true medical emergency. You want to make sure first responders are on the way. We recommend using a landline if it's readily available, because that number, when you call 911, will go right to your local police or fire station. If you call 911 from a cell phone, sometimes it doesn't always get routed to your local police or fire department, so it may delay. If you're going to leave the person alone for a short period of time, you want to put them in a position where if they vomit, they're not going to aspirate or choke in their vomit. So you want to put them in that position. Then call 911 and then come back and check for breathing. The best way to check for breathing is using the head tip chin lift method. You want to put your hand on their, palm of your hand on their forehead, tip their head back slightly, and then lift their chin with your other hand. So it'll kind of be like this. Open their mouth, open their airway, put your ear down and listen to see if they're breathing. And at the same time, look to see if their chest rises. If they're not breathing, you're going to pinch their nostrils with your hand that's on their forehead and breathe into their mouth a few times. If they're still not breathing, if you get no response, then you're going to administer Narcan. It's very important that when you administer Narcan, that you follow these steps. You open it from the package, you hold the Narcan like this, so you get your fingers right on between the nozzle. And you want to insert the nozzle up into the nostrils until your fingers reach the nostril. At that time, it's okay to push the plunger in only at that time. If you push the plunger before you get it in their nostril, the dose is going to be wasted. It won't make it in. So you want to make sure you push it in, make sure it's in there good and solid for a second, and then push the plunger. And then you want to go back to rescue breathing. There's a pretty good chance that if they stop breathing, their heart may still be beating, so that will circulate the Narcan through their system to get into their brain. But you also want to make sure you introduce oxygen so you can push that along. So you're going to rescue breathe every 5 seconds, give them a breath for 2 or 3 minutes. Check to see if they're breathing again. If they're not breathing and you have another dose of Narcan, you administer another dose of Narcan the same way. And you keep doing that until help arrives and EMS arrives. Learn to Cope is a support organization in Massachusetts that was founded by a lady named Joanne Peterson, whose son was affected by substance use disorder. She and a couple of friends, they didn't know what to do, so they started having meetings. And it's turned into a organization in Massachusetts that I believe has about 29 chapters now across the state. Learn to Cope is a support group for family members, friends, and loved ones of people suffering from addiction. It offers a place where people that are suffering can go and seek help. We have meetings, mostly via Zoom, but now that the pandemic has come to an end, we have in-person meetings. If you want to go for more information on Learn to Cope, go to www.learn2cope.org. It will provide information to where the family support meetings are. It will provide information on a discussion board. It's free. You can register online and you get any information you want from the discussion board or ask questions. And I can almost guarantee you if you have a question about substance use, alcoholism, anything like that, somebody's asked that on the discussion board already. And you go on the discussion board, you can probably find that answer or you can ask the question. The in-person meetings are usually an hour and a half, and they have open sessions where we can talk. We can offer advice, we can offer what worked for us. We have a lot of recovery speakers and people who run recovery centers come in and give us hope that our loved one will find recovery and guide us into help our loved ones find recovery.